Hi everyone, how are you? It is Dr. Splickle, functional podiatrist, human movement specialist, and founder of EBFA Global and Naboso. I'm here to speak to you about how you can actually improve foot function, offset pressure, and decrease symptoms by using paddings. So I absolutely love some of these different paddings and strappings that you can do on the foot, and you can think of them almost like taking the place of an orthotic, or they actually can be integrated into an orthotic to get improved efficacy from that orthotic. Now, there's 4 main pads that I'm going to go over, and these are things that you can buy on Amazon. You can cut them out of a roll of felt, so it's something that is very easy to access. It's not locked to podiatry. So here we go. Now, the first pad that I'm going to go over is called a dancer's pad. That dancer's pad is perfect for those that are experiencing limited first MPJ dorsiflexion, sesamoiditis, maybe they have a functional hallux limitus. There are many conditions around the first MPJ and sesamoids in which this padding is perfect. After I go over each padding, I'm going to show you how to put it on the foot. The next one is going to be a U-pad. Now the U-pad is great for submetitis. Maybe there's a really painful hyperkeratotic area. It's called an IPK, so it's a corn that grows into the foot. You can use this U-pad to offload that area. For many people who have hammer toes in the second, maybe they have a Morton's toe with a hammer toe in the second, and they're starting to get symptoms right underneath that met head, or they might actually have a plantar plate tear that is associated with all of this second MPJ pathology. Using this U-pad can be very beneficial. The third one, which is probably my favorite, is going to be a metatarsal pad. This metatarsal pad supports foot splay, the opening up of the metatarsal heads, the opening up and spreading of pressure so that it's not localized onto those met heads. When we walk and when we stand, we actually don't want passive weight on our met heads or on the ball of the foot. We want it to be lifted. So this is great for balancing out the forefoot. Also, if someone has maybe diffuse met head pain, which is called metatarsalgia or neuromas, really good for that as well. And then the final one is going to be a scaphoid pad. Sometimes people will refer to this as an LA pad, but it is designed to lift your medial arch. So let's say you have someone with navicular drop, you have someone with post-tib tendinitis, plantar fasciitis, mild overpronation, and you don't want to go for a full orthotic, you could use something like this in the shoe. So here we go. Now, all of these paddings, I recommend getting them in 1/4 inch felt. So you do not want to use pads that are thinner than a 1/4 inch because it's really hard once you stand on them to actually get any offloading benefit. You also want to avoid materials such as foam, because when you stand on foam, you bottom it out and you're actually not getting any of that offloading as well. And then finally, you do want to avoid silicones or gels. Dr. Scholl's makes a lot of products with these materials. They just do not sustain or offload in the way that they were designed. So go for 1/4 inch felt. Now, our first pad that we went over is going to be our dancer's pad. Now, that dancer pad placement, obviously we're going in the bottom of the foot. We're going to place it here. So the placement of that dancer's pad is, again, to offload that first met head, the sesamoids, or to support plantar flexion of the first ray. A lot of these paddings, when you buy them, they will actually have a sticker on the back side. So you just take off the paper and you'll take that dancer's pad and put it directly on the foot. So right here's where I'm putting it. Now, if I don't want to put it directly onto my foot, I just take my insole or the orthotic and I will place it here. Now, if you do not want to feel the edges of that padding, what you can do is put it on the bottom. So now I have just one orthotic, so I can't show you the opposite, but I will put it on the bottom. And then when I place it down back in the shoe, it's going to offload that first met head. It's going to support the timing of the plantar flexion of the first ray to support and favor first MPJ dorsiflexion. So it is great. Okay, all of these paddings and strappings can be temporary, a temporary solution. They could be just when they're barefoot and they're working out, or they can't be in their shoes and their orthotics, or they're integrated into orthotics as a permanent solution, again, depending on the foot type. Your next one is going to be the U-pad. So oftentimes U-pads are used for second MPJ pain. That's probably the most common. Similar to the dancer's pad, you're gonna put it directly onto the bottom of the foot. You can see I'm putting it so that my second met head is right in the center of where that U or that void is. It is taking pressure and putting pressure all around that met head, okay? Now you can cut these. So let's say if I have submet 5 pain, I'm gonna cut one of these little arms off like this, and then I'm gonna place it on my foot just like this. Perfect, easy way to do it. Another way that you could use this is maybe if I'm feeling bump pain from my bunion, I could put it right here. So now I'm on the medial side of the foot, trying to take pressure off of that medial eminence. I can even put it in the back of the heel where you can get a retrocalcaneal bursitis, and that could offload that area as well. Great, great multi-purpose padding. Of course, you can put this on the orthotic or the insole as well. Let's go towards our met pad. So now the metatarsal pad, the placement of this pad is super, super important. Many people, and if you go online and just Google metatarsal pads, you will see the metatarsal pad placed in the wrong place. The purpose of the met pad is to shift the timing of your met splay so that it happens sooner in the gait cycle. So we want to put the metatarsal pad right there. Do you see that I'm actually not on my met heads? Oftentimes when you Google this, you'll see that people place it directly on the met head, or a patient will say, I have neuroma pain, I have metatarsalgia, pain in the ball of my foot. If I put a cushion on my ball of my foot or my met heads, it'll take away the pain. Not the way that it works. In the foot, everything is about force and pressure. So we're trying to take the force and the pressure away from our painful area. So this is where you will want to place that metatarsal pad. You could also go a little bit shorter. Sometimes some patients prefer it a little bit shorter, but this is where I like to place it on patients. You never go further distal than right where I am right now. If you do not want to put this on your foot every single day, not a problem. You find that placement on your insole or orthotic. You would put it on top, or of course you could put it on the bottom, right? And then when you stand, you'll get that opening up of that metatarsal splay. So you got neuromas, metatarsalgia, diffuse calluses on the ball of the foot, hammer tone pain, feels like you're walking on your knuckles. All of this is going to be used metatarsal pad. My fourth and final pad that I want to go over, which is one that I will actually use to build up minimal shoes for my patients, is going to be a scaphoid pad. Now, a interesting fact is that another name for your navicular is your scaphoid bone. So this placement is to lift the navicular. So we're going to place this, you can see that I'm going to place this on the bottom of my foot, and it's gonna hug my medial arch. Do you see how it's hugging that, right? It's placed right here. So if this was in my shoe, it would be lifting my medial arch right here, this 1/4 inch, which is great. This is, again, what I will use for post-tib tendinitis, navicular drop, plantar fasciitis, in unstable first ray. Many, many conditions are associated with that navicular dropping. So we can use this as a little bit of a buttress to support, especially if the patient is like, I don't want a stiff orthotic in my shoe. Not a problem. I'm gonna build up your shoes with these different paddings to still keep you minimal, but get you a little bit more support just based off of your foot type. And then if we place this onto the orthotic or insole, this one I like to put on top would be right here. And I'm just placing that right on the top, okay? I'm building up the medial arch. So now, this is not all the pads. There's many, many different paddings and then of course strappings that you could use for the foot, but regardless of the type of padding that you're gonna use, the material and thickness is the most important. And then of course, you gotta place it in the right place. So you're looking for 1/4 inch felt. 1/4 inch felt, just go to Amazon, you can get rolls of 1/4 inch felt and you could just cut these paddings yourself. I like to have the adhesive on the back, so you just peel the paper off and you have an adhesive. It goes directly onto the foot, directly onto the insole, onto the underside of the orthotic, or again, you can customize it and get it built into your custom orthotics. I hope that you found this beneficial. If you are looking to learn more about how to improve your foot function, or if you're curious about maybe some foot conditions that you have, please visit dremilyslickle.com. Take care.